Well, welcome to another episode of Parenting in the Far North. I'm your host, Erin Bureau. Today's guest is Dr. Ian Ford, an optometrist at Alaska Eye Care Centers. Originally a farm kid from Montana, he started wearing glasses in third grade, which he says got him interested in the profession. He's married to his wife, Jessie. They have two kids, Mallory, who is 5.5, and then we have Owen, who is 2.5. He's here to talk about kids and screen time and shed some light on pediatric eye concerns. So please welcome to the podcast, Dr. Ford. Thanks so much for being here.
Yeah, thanks for having me here today.
Yeah, today has been a crazy snow day, so I appreciate you making the drive in from Palmer.
Oh, I know. The roads were so much fun.
Yeah, I bet so. Well, you're here. Before we get into kind of some of the questions I have here, just tell us a little bit more about yourself. I know you're an optometrist, and this is interesting. So in third grade, you got glasses. And
Correct.
How did you become interested in the profession at such a young age?
Well, for me, I knew that I wasn't going to be a farmer. It was just too much work. And the optometrist, it was always like the friendly doctor to go to.
Yeah.
Like I didn't have to get any needles. I was deathly afraid of dentists. And I always came out feeling, better than I was when I went in. So, sixth grade, I started doing a little shadowing, and now, however many years later,
Here you are.
I'm here.
Wow, that's amazing. Well, today, this is kind of fitting because kids, with the schools being closed, they're doing remote learning. A big thing that I've been wanting to talk about and have a guest on is talking about screen time and vision and kids and looking at the tablets. So first off, out the gate, what are some of the most common eye issues that you see in young children?
One of the most common ones that I see is just hyperopia, farsightedness. A lot of times, we're all born farsighted, but sometimes you just don't have a very good focusing system, and then that can lead to unnecessary headaches, eye strain, everything else like that when you're doing any of that in your task, and then you can start to lose your attention and just not perform in school quite as well as what you should be doing. So sometimes with those kids, they go through undiagnosed, just thinking that they have learning problems when that's all they need is a pair of reading glasses to help them focus a little bit more. So,
Interesting.
Yeah.
Screen time. I'm sure you get asked that question a lot. You know, the tablets, the phones, not just for kiddos, but adults, but mainly right now, just kind of talking about kiddos and the screen time. Your take on it and your thoughts as an optometrist.
I think that it's a great tool to have, but I think that there definitely has to be more to it than just screen time. A lot of it just boils down to when you're spending that much time looking at anything, we forget to blink. And when we forget to blink, our eyes dry out. And we just haven't had these around this long to know like what the long-term effects are going to be based on that kind of thing. I know you see it like where the kids just looking at something forever. I mean, we do it too with our computer screens. And they say that for every 20 minutes you spend looking at something up close, you're supposed to spend 20 seconds looking at something 20 feet or further away to kind of reset your eyes. But I just know that it's not one of those things that we do unless we actively think about it. So, and then, with the tablets, what they say is all that blue light, it can start to disrupt your melatonin levels. So then your disrupted sleep cycles at night. So a lot of the times you start having other issues that kind of go along with it. So I think it's a great tool because it's a good way for kids to learn. It's a good active way for them to be entertained in it rather than just looking at books all the time. But I think there's got to be a little bit of a balance there too.
Yeah. Get off the tablet and go read a book, back and forth
exactly.
or something like that. You mentioned blue light. Like you'd see the blue light blockers. Do those help? And is that something that damages your eyes? I know for some they're non-prescription. So for like I wear contacts, I'm staring at the screen, I stare at a teleprompter. I've noticed where I have to look away, but my mom got me some blue light blockers and they've actually been helping. So am I on the right track?
You are on the right track. I know what all the studies are saying out there. There's blue light's a higher energy light, so it's kind of close to UV light on the spectrum of everything. With that, you can potentially be causing damage in a younger eye. There's no studies out there right now because we haven't had screens around long enough, but in theory that lens is what it's absorbing all the blue light, and then the macula deeper down in the retina, that can also be absorbing that blue light. With you and me, our lenses absorbed a lot of that, so it filters a lot more out, but for younger kids, their lenses are still developing. So they might be getting a little bit higher exposure to a lot of that higher energy light. So it's not one of those things that it's proven, but it's one of those things that in theory it could potentially be causing problems. So it's not doing any harm to put on a pair of blue light glasses.
Yeah. Well, kids being so young and, being exposed to the lights and screens, is there anything that's coming like down the pipeline or any innovative new ways that parents can kind of, combat that or be a step ahead before they have to get to the optometrist?
Well, I think just actively regulating your kids and making sure that they're not just staring at a screen all day.
Yeah.
One of the big things that's coming up is my fear would be like a myopia epidemic, just because when you're staring at something up close for hours on end, you are kind of locking in your focusing system to look at stuff up close. So when you try to look far away, sometimes the eyes are kind of artificially nearsighted, so everything's a little bit blurry until everything resets back to zero. So my worries are just with a developing eye, when you're looking at something up close for an extended period of time, you might artificially induce that nearsightedness. And it's one of those things that's kind of been proven in Asia. Just within 2 generations, there's been a huge increase in the number of nearsighted kids that are out there. So it'll be interesting to see kind of what kind of effect we have here. I know that it's already up like 40% in some of the populations, Western populations anyway.
Is that something, if they come to an eye appointment, that you can see, or something that is developing, or is it a little bit harder?
It's a little bit more to it. We can definitely see if a patient is nearsighted, kind of just we can see it without even answering your 1 or 2 or anything else like that. The tricky thing is just knowing like a myopia progression. There's a higher chance that if you have parents that are nearsighted, that you're going to also be nearsighted.
Yeah.
And then it's just a matter of how quickly are things changing. If it's, generally we say, come in every year, every 2 years, we'll just take a look and make sure nothing's changing. But with a lot of these kids that are myopia progressors, it's basically within 6 months that they're having changes already. And it's one of those things you have to do some early intervention to try to slow down that progression so they don't end up like the parents.
Yeah, and you said a common question you get is, when do my kids need to come in for an eye exam?
Yeah, great question. So the American Optometric Association, they usually recommend the first eye exam by about 6 months. It's definitely a little bit different than what we're going to do with you, but we can definitely see how the eyes are kind of developing, make sure there's no eye misalignment, make sure there's no big difference between the 2 eyes, make sure there's no real health issues on the infant's eye. And then based on those findings, if everything looks normal, we usually recommend coming in right around age 2 to 3. The kids, again, they're not going to have to answer 1 or 2, 3 or 4, but we're going to be able to get a little bit more information from them. And then depending on how that one goes, I usually try to get them in right before kindergarten to make sure that they're not going to have any troubles kind of going through school, check the color vision, and make sure that there's nothing that's going to show up abnormal that the teacher needs to know about. And then go from there.
Is there anything about a child's diet that can play into eye health? You always hear growing up, eat your carrots, it's good for your eyes, and their diet in general. Oh, yeah.
The green leafy vegetables, the colorful vegetables, fish, they're all great for eye health. They're all nutrients that are kind of good for the macula. They're also good for dry eye cases, which is another thing that we see with increased screen time, is increased incidence of dry eyes. So the carrots, it's not like it necessarily has to be a carrot, but the nutrients in a carrot are definitely good.
Some kind of vegetable.
Exactly.
For kids that are, in sports and, protecting their eyes and their vision in a different way versus just glasses, what are your thoughts on that, protecting their vision?
It's definitely one of those underlooked things when you're thinking about it. I know when I was doing my school, I went through sports vision, and that was one of the big things, was making sure that they have some sort of eye protection. Just risk of getting poked in the eye when they're playing football, or an elbow playing basketball. Eye protection, definitely important, and it's one of those things you kind of overlook a lot of the time. When we're riding a bike, we might get a branch in the eye.
My goodness, I hope not.
So you don't want, if you can avoid that kind of stuff, it's good, but you don't also want to have to cause more problems, by decreasing peripheral vision for a lot of those sports by putting on a pair of glasses. So there's a balance,
Does light and dark, living in Alaska, we are certainly coming into these darker, times, colder, the winds. Does all that play a factor as far as like your environment? And do you kind of notice any difference with people being up here in Alaska? And
You just keep circling back to the whole dry eyes.
I guess dry,
But Alaska, it's such a desert here, you know. And then we're all in office buildings with recirculated air, so it's just, and we stare at screens more. It's just one of those things that our eyes are just naturally drying out a lot more.
Yeah.
One of the common symptoms, like I have patients come in complaining about, my eyes can't be dry, they water all the time. But that's one of the symptoms of a dry eye patient. You get like a reflex tearing instead of a protective coating front of the eye. So yeah, same thing with kids. You might notice that their eyes are red. You might notice that they're blinking more to try to produce more tears. They might have some watering eyes. They might complain that their eyes are getting tired. All those are kind of symptoms of like computer vision syndrome, where you might need to have reading glasses or supplement your body's natural tears with like an artificial tear or something like that.
That's what I was going to ask. Is there something like an over-the-counter, like if you, like my daughter, she's nearsighted, she wears glasses, but I've catch her every now and then kind of doing that blinking. And I'm like, and so now that you say that would something like an over-the-counter eye drop work in that case, or?
That's usually what I recommend kind of for like a first line of a defense is just supplementing the body's natural tears with an artificial tear. You want to stay away from get the red out ones like the Visine or the Clear Eyes or some of those ones, because they can cause more problems than actually treat the underlying problem. But yeah, a good artificial tear, just putting that in the eyes. I think of it like chapstick or like lotion. If you put it on before your eyes start bugging you, then it's going to prevent them from drying out quite as much. It's one of those things, though, you shouldn't be having to take it like every 20 minutes or so.
Yeah.
It's one of those that up to 4 times a day, or else you might want to dig into something a little bit more aggressive for treatment.
Gotcha.
That's what I usually tell patients. So.
Well, we talk a lot about the kids here. You know, if you see, I'm sure, both with parents as well. What would you love to tell parents, you know, that you see it on a day in and day out, that you just would love to kind of like nail this reminder advice into them?
My main thing for parents are, just because you think that your kid can see, it doesn't necessarily mean that they can. I know that I've had a few patients that have come in just young, you know, and you always say, take it with a grain of salt, like, oh, my kid's been complaining they can't see. And sure enough, they come in, they have some health issue that's going on with their eyes, and the parents like, oh, maybe I should have listened to my kid a little bit sooner. And there's always things that can be done, you know.
And contacts for kids, is there like too early of an age that they start wearing, or do you guys mainly kind of start kids off in glasses?
For me, it's all parent-based. If you think your kid's responsible enough to wear contacts, and if throughout the testing, if I realize, oh yeah, this kid's not going to be too difficult to teach how to put them on and take them off, I have no trouble at all fitting a younger kid in contacts. It's kind of interesting. Some of the myopia management is actually with contact lenses that are out there. There's one company that has a soft daily disposable contact that kind of slows down the myopia progression. There's another hard contact lens that almost acts like a retainer for your mouth, but it's a retainer for your eye that changes the shape of the cornea to kind of slow down the progression. It's definitely an option, but it's not something for everyone. Usually I tell, if there's a big disconnect where the kid really wants them but the parent doesn't think they're ready yet, I say, well, this is your opportunity to prove to your parents that you can do it. Keep the bathroom clean, practice good hygiene, and then we can revisit this like 6 months, 3 months, whatever you're thinking there. But.
And do you maybe recommend, like, folks who have contacts, maybe have glasses as like a backup to kind of interchange that, you know, when you have to take them out or give your eyes a break?
Yeah, it's always a good idea to have a backup set of glasses, just because there may be some day where you have an infection. Just putting that piece of plastic on the eye increases the chance of having an eye problem. And yeah, you don't want to be without being able to see. So it's not like it has to be like a super fancy pair of glasses or anything like that if they're primarily just backup, but something functional that can get you through a day or two or a week.
Yeah, I've been there, and it is not fun.
No.
Just back to your profession of being and how long have you been doing this?
17 years now.
17 years. Yeah. What do you get out of it? What do you love about what you do day in and day out?
I just love the reward of like having people come in, they have a problem, and I can make things better for them most of the time, you know. Vision's one of those things that we take for granted. It's always good until it's not. Yeah. And then you have to find out, well, why isn't good anymore? Is it something that's easy, like, oh, here's a pair of glasses, this can get you seeing better. Here's a pair of contacts, this can get you seeing better. Or is it something a little more complex that, oh, now I have to refer you to a specialist to have them kind of manage this a little bit differently. So I'd say that's the most rewarding part for me, is just being able to help people function better.
Yeah, I've seen some of those videos, and I'm sure you've experienced it, where even just the youngest of kids put on glasses for the first time? Like, what is that reaction? Do you have a story you just remember a patient that stands out where they literally actually kind of can see clearly, that has to be a pretty cool feeling.
Oh, yeah, it's a great feeling. Like when you have this kid that comes in and the parents like, well, I don't know, they might be squinting. It's hard for me to tell. And like you go through and you're trying to do the testing and they're not getting very much from the kid. And then you do some of the testing yourself and you're like, oh, yeah, there's a pretty big difference between the two eyes. And you tell the parent, okay, well, here's a pair of glasses. Try to wear them as much as you can. It's kind of like breaking a new pair of shoes. You're not going to like it to start with, but kind of as you get more used to it, it's going to become a little more everyday kind of thing. And then next thing you know, I'm like, well, I'll follow up in 3 months and see how you're doing. And the kids' parents saying just, that's all my kid does. First thing they do in the morning is just put on this pair of glasses, and it's just changed everything for them. So it's always kind of a good feeling when you're like, you can fix something like that.
And I imagine, too, getting fitted for contacts and or glasses, having it properly fit on your face, that's an important part, too.
It is. A lot of times with glasses, the opticians, they take measurements to make sure that the glasses are fitting your face properly, and they're not going to be sliding all over the place, and you're not going to be able to look over the top of them or anything else like that. And then a lot of times if the lenses are out of misalignment, you're not looking through the sweet spot and things aren't quite as clear, then all contact lenses, they're not created equally. It's not like I can just say, oh, you have a -2.5 there that I can borrow. It's one of those things that they're actually fit to your eye. Different materials are better for different people. Different modalities of wear are better for different people. And there are actually some contact lenses now that have the blue light filter kind of built into them too. So it's,
really?
Interesting technology that's out there.
Tell you, what will they think of next?
Right.
And I imagine, if you feel like something's off with your body, your body best to go get it checked out or go to a doctor. Would be the same thing for, your eye vision and your eye health.
Yeah, exactly. Generally, just keeping with a checkup every year or two to make sure that nothing's changing. That's good. And then a lot of the symptoms that I need to see you sooner than later for are like sudden changes in the vision or any injuries or any kind of redness or anything just that's abnormal, I guess. It's like you'll always know when you have something going on. Or you'll be able to tell when your kid has something going on.
Well, that's all I had for you question-wise. I like to let my guests kind of have the last word, final thoughts. So anything else that you want to mention or add or just share on the topic that I didn't ask or you feel is important?
I think that, just reiterating that eye health is very important to people. You only get one set of eyes. It's not like we can get you a replacement set of eyes if there's anything that's going on. Other nice thing about kids is kids' eyes are plastic. It's one of those things they're kind of constantly developing. So the sooner that you catch problems, the less likely it's going to be a bigger issue kind of down the road. So early intervention is definitely a better being proactive instead of reactive in a lot of those cases. So.
Some great tips. Well, thank you so much, Dr. Ford, for coming on. We certainly appreciate it. It was very interesting and insightful. Thank you all for listening to another episode of Parenting in the Far North. And don't forget to like and subscribe.